Hi, I'm Alex,
Hi, and I'm Liz.
and this is the research room, and we finally have another guest that's not me. Yay! I
Yay.
think we should all clap for that. Actually, like
We
that's
should. It's applause worthy.
exactly. So today we have Dr. Annie Jung to discuss a very relevant paper today. Oh, actually, I forgot our whole tagline. So let me. We're going to keep this going, but I'm going to say it. So this is the research room, and we are a space to make research by the people for the people. Um,
Oh, good. You
Sorry,
got
I was
that
just
right. Yeah.
yeah.
Yay.
Perfect synergy.
So, Annie, your paper here concerns for others increase the likelihood of vaccination against influenza and COVID-19 more in sorry, more in sparsely rather than densely populated areas.
Why
Okay,
is that
so
so long?
that
I
is,
know
yeah.
it's my own paper, but it's like
Every
I still don't
title.
remember my title.
Mhm.
Yeah.
I'm always surprised at how long mine are. Like, why did I think of a sentence that long? Okay, so yeah, I think I'll just go ahead and hand it off to you. Let you talk about this paper generally.
Yeah, so maybe I can start with just a brief background. So, just like any human behavior, vaccination decisions are very complex. There are so many factors that influence people's decision to vaccinate. And some of the reasons that's been identified in prior work that prevents people to vaccinate have been some personal reasons, like their religious beliefs. They just don't trust vaccines. They have less access to healthcare, and all of these reasons. So what researchers thought was, what if we make people to move away, from these personal reasons, and make them think about some other pro-social reasons for getting vaccinated, like, oh, if you get vaccinated, you're going to help other people around you, you're going to stop the spread of the disease, so you're actually contributing to the greater good. So these kind of pro-social emphasis of vaccination has been actually shown to be effective in increasing vaccination, but the results have been inconsistent. So our first motive was to, if the results are inconsistent, what are these factors that moderate the effects of these like pro-social communications about vaccination? So in that sense, we identify social density as one very important factor that influences whether people will vaccinate to protect others or not. And the general finding is that people are actually more willing to vaccinate for others when they live in less socially dense areas compared to socially dense areas like crowded metropolitan cities. So
Yeah, no, that was great. There's a lot that you said there,
oh
Yeah.
no,
which is
did I ramble too much?
no, no, not at
No, it
all.
was a
This
great
is
intro there.
right. Yeah, this is
Okay,
your time to speak.
I'm very proud.
Yes. So, okay, social density as a moderating factor. Can you unpack that a little bit? What does that actually mean? What does it mean to like moderate this idea of vaccination?
So that just basically means that where people live will influence the extent to which people would be, willing to vaccinate to protect others. So that's the definition of what it means to moderate. But if you have any follow-up questions on that, I can answer it.
No, so that's great. So it'll influence the amount that people might vaccinate, and this was for flu vaccine, right?
And also COVID.
And also for COVID, for
Yeah.
both. Okay, cool. So I mean, it seems like you were pretty like well equipped in order to like make that kind of conclusion because of just how huge this study was. Like you had people from all over the U.S. In order to do this as a very representative sample. So I guess I mean. Would you feel comfortable saying that like this is actually something that you can expect across America, or are there things that we still need to be cautious about when trying to interpret this?
Um, So I'm pretty much confident in the results themselves. So there are several reasons why. For example, it was a nationally representative sample, meaning that the structure of a sample did reflect the actual structure of the United States in terms of, the proportion of gender, the proportion of ethnicity, and also, we used different indices of social density just to make sure that this is a consistent and reliable effect. For example, we used metropolitan status as one index of social density, and also population density, and also the amount of urbanization in participants' residence. So the results ourselves are, I would say, quite reliable, and it should, reflect what's really going on in the United States, I would say.
Yeah.
Yeah, so one of the things that you're mentioning, is social density. So that seems to be like a big factor, right, in the paper. So can you explain, like, why we would expect differences in vaccination depending on that factor?
Yeah, and I should also add to that. So in addition to what Liz asked, so what I mean by social density is basically crowdedness of people's environment. We needed to come up with a more proper word for crowdedness. So we ended up going with social density, but social density basically means crowdedness. And given our research is really about the social motivation to vaccinate, we thought that if anything moderates this social motivation to vaccinate, it should be their social environment. So how many people in daily basis, on daily basis, how much people interact with others. For example, if people live in crowded areas, they're more likely to interact with more people versus not. So our original hypothesis was that people will actually be more motivated to vaccinate to protect others in crowded areas compared to less crowded areas because they interact with more people on a daily basis, right? But as I said, we find the opposite effect. People are actually less likely to vaccinate in order to protect others in crowded places. So we're like, oh, this is interesting. It's not
Don't you
what we
love that with
expected.
findings? It's like sometimes the
Yeah,
opposite of what you expect,
exactly. So that's why we had to test, 3 indices of social density because, we needed to make sure that this is like a reliable effect. And because it was counterintuitive, we also had to run additional experiments to actually find out what's going on. So in these experiments, we actually manipulated social density and then, measured several, psychological items to get at the processes that goes on in people's minds. And what we find is that if people live or if people are exposed to crowded places, even though that doesn't really affect how much people care about others, it affects their perceptions of impact. So what I mean by that is that if, there are so many other people around people, they feel like whatever they do to protect others will just be like a drop in the bucket. Like, what does it matter? It's not going to make much difference in actually improving the community compared to people who live in and who are exposed to less crowded environments. But I can follow up on that if you have any additional questions.
I mean, I have
Yeah, I mean,
questions, but I'm sure Alex is too.
Yes.
I don't know, like, well, there's a lot of things I can ask. Yeah. So with the social density sort of thing, if it comes down to like impact, does it matter who is surrounding them? So like, is it friends, is it family, is it strangers? Like, does any of that like matter? Because I would imagine like people imagine people in their lives, and they might think that like they're going to make more impact if it's a family member, or if it's a friend, rather than a stranger. So like, can your results speak to any of that?
I guess given the mechanism finding were identified through experiments, in the experiments itself, we didn't really differentiate between like, oh, is it concern for family? Is it concern for friends? So I can't really provide like a satisfactory answer to your question. But then our first study, so the nationally representative big correlational study, in that study, we did have, separate measures for, your concerns about protecting your family or friends, or I think it was family, neighbors, co-workers, and strangers. We did find that, generally the mean people were on average more concerned about protecting their families, obviously, than strangers. But then the pattern did not differ. So what I mean by that is that even if we were just to analyze people's concerns for protecting their family, that concern did motivate actual vaccination more in less crowded places than more crowded places. And this pattern was similar for across all, concerns for neighbors, concerns for coworkers, and also concerns for strangers. So I would say the pattern does not really differ depending on who this pro-social concern is targeted to, but it's not 100% conclusive because we didn't, separate them in the experiment itself.
Yeah. No, I mean, it's still good information that like it doesn't necessarily matter. It's just this prosociality sort of thing. Like it's on average, it's the same effect.
Yeah.
Now, your results can't really speak to this, but I'm actually wondering, like you were talking about enclosed spaces and like how crowding's basically the same thing. So there's been like a lot of news coverage lately about like COVID outbreaks in prisons and like, jails and like correctional facilities. So even though your data can't speak to this, do you think that it's within the realm of possibility that, this could happen with like low pro-sociality, high density, in like a setting such as that?
I definitely think it could be one contributing factor. The reason I say this is that the effects of social density on the extent to which people are motivated to vaccinate for others, this effect was even found when we tried to manipulate social density with very simple procedure. So I'm guessing that, social density in other environments, just like you said, like prisons, could still influence this pro-social motivation to vaccinate. But, there are several other things that goes on in prisons and, other places, right? Maybe the quality of social interactions could be different, and norms for vaccination could also be different in these places. So I would say that if we really wanted to test if pro-social concern also has a differential effect in these environments, we need to control for unique factors that functions in these environments as well.
Definitely. Yeah. But it's cool to think about like other settings though, where this could actually still be relevant. So.
And I was actually thinking of schools. For example, there's been a lot of reports of like how students don't socially distance enough. They still go to parties when it's in the middle of the pandemic. And usually schools are really crowded places, right? And I feel like the mechanism we identified could be in function in this kind of situation as well. For example, if you're one in a million, campus residents who can, engage in social distancing, who can wear masks to make difference, it's like, am I really making a difference? There are so many other people who don't do it. Like, would I doing something can actually contribute? So in that sense, I can totally, resonate that students might be less motivated to wear a mask, to socially distance, for the sake of others, in these environments.
Especially now that the pandemic's like changing, in terms of the course and trajectory of it. I mean, still recently though, people are like traveling, everything has changed, even though we're still undergoing the pandemic. Some people are treating it as if it's not still happening.
Yeah. And that can actually lower people's motivation to do something, for the community.
Yeah, I think especially if people are thinking like, if this pandemic is over, like, what impact am I going to have now at this point, right? Like, that kind of thing. So frustrating.
It is. Wear your mask, people. Even if you're vaccinated
Yes.
and you're in a big place, maybe you should wear it. Okay, that's
We
my
should
note.
be wearing masks to show some examples right now, actually.
Then they can't hear us, though. I mean,
well, we can shout
over our masks. Okay.
Okay, so it's not necessarily that the level of prosociality is different in these areas. It's this level of impact kind of thing. So is that something that like we can teach people? Like, do you think that's like some way that we can actually like make an intervention to like, and maybe this is sort of what you were saying already, that like in the school setting, if we can teach kids like, hey, like you are still going to have an impact. It doesn't matter what your friends are doing. Like you could save the lives of like 5 people, 10 people, 100 people. Like this virus, it spreads in an exponential fashion, which I kind of didn't want to say because like that's another one of your findings, but like
no, that's not my finding.
I mean, yeah, you didn't find out that thing, but how people perceive it.
Yes.
So I mean, I guess, yeah, like would you say that this is mostly a learned kind of behavior, and like is this something that you think is it easier to learn it when you're in that rural kind of setting and you know these people that are around you, and so like you see them as people, you know that like you know what their lives are like, you know what their daily routines are, you know that like you'll have an impact, right? As opposed to like all these other people, like maybe you meet with 100 people a day, but like you don't know anything about them, like you just know that they exist. Sorry, I said a lot of things there.
No, but you raised a really good point, because so there is a very important finding, especially in the prosocial domain, that like identifiability really matters in terms of like in perceptions of impact. So, this explains a lot of things. For example, people, donate to this one, dying kid with a picture, compared to like thousands of people who are still dying somewhere in the world. So that kind of very like visual saliency and like identifiability can definitely increase perceptions of impact. And I do think that, just like Alex said, like in large cities, you definitely come across a lot of people, but like they're just random people, they're always there. You hardly interact with them, you don't know who they are. So, increasing the identifiability could definitely increase perceptions of impact. That could be one thing, definitely. I'm trying to think of other ways to increase perceptions of impact. And I'm thinking one is that these are all perceived. They're not, real, right? But in reality, if you even look at the statistics of how virus spreads, it spreads much more rapidly and, like you said, exponentially in more crowded places. So if people know that this is the real, situation, that in the real life, they're actually making more impact by vaccinating to protect others, I think that could be one intervention for people, living in large cities, who think that they don't make a difference.
No, you are chock full of interventions, and it's great.
It's true.
Yeah.
So I guess maybe my last question, unless Liz, do you have a question?
I mean, I have something that I
Sure.
was thinking about. So
Sure.
do you know anything about like specific factors? So I mean, do demographics matter in terms of that? Like say in like a big city, could it be the case that people are more likely if they perceive, like you're talking about perception, could it be like certain demographics, they are similar to these people, so then they're gonna have that perception? Like I'm just thinking of like bystander research and things like that, where you're more likely to help somebody if they're like similar to you. So I don't know, similar demographics like that.
Yeah, so we definitely thought about that. Actually, we were wondering when we first found, the effect that we found, we first thought it could be like the ethnic diversity in large cities, because there are so many people who are dissimilar from you. Maybe
Right.
that's, that makes people less motivated to vaccinate to protect people around them. But we didn't find that, diversity index to have any impact on people's motivation, pro-social motivation to vaccinate. So um, it could be, but at least in our findings, I don't think that is a alternative explanation. But maybe
Interesting.
future research can try doing that.
Your next study, you can tell us the answer.
No, I don't want to do this anymore. No, I'm
It's
just
okay.
kidding.
Okay. Somebody else in this field can give us the
It's not
answer and they can
it's
come
not
on
very
here.
pro-social of you, Annie.
Yeah, maybe my next study. But that's an interesting question, though.
Mhm. Yeah, no, that's such a good point. Like, so there's probably other factors, right? It's not just pro-sociality and the things that like might change pro-sociality. Like, obviously, other things matter, right? I mean, honestly, you disagree. Like, maybe pro-sociality is the most important thing. Do you
Um,
think that?
no, I don't think that at all. I think pro-social. No, I don't think that at all. I don't know how I should add to that.
That's a good answer. Just saying, hey, honestly, I don't think so.
Right.
Oh, but there's this one interesting finding that I wanted to point out
Hmm.
in terms of like, what could be other factors that make people, be more concerned about others in general, especially in the vaccination context. And what we found was that the more people know about vaccines and how vaccines work, there's higher likelihood that they also care about protecting others from the vaccine. And I'm guessing that is because the more you know about vaccines, the more you become aware that getting vaccinated is not only a personal decision, but also a social one, because by getting vaccinated, you're also protecting others. So, educating more about vaccines and, what kind of functions getting vaccination has, could be one way to increase, people's concerns, general concerns about protecting others through getting vaccination.
Mhm.
Yeah, so that was one interesting thing.
Yeah, that's such an important point. Like, I think people that might have vaccine hesitancy, like, I mean, there's plenty of like valid reasons for that. And one of them is definitely like the right, like you're infringing on like my privacy, you're infringing on my health, you're infringing on like my decision making, things like that, right?
Mm-hmm.
Which is like, yeah, that's super valid. But then like the choice to not vaccinate, that's you now infringing on other people's like health, right? Like,
Mm-hmm.
because you could potentially be spreading the virus. So it's like, I mean, it's important for you. It's just as important for other people. So we have to be in this together, right? How
Exactly.
do you?
Yeah.
Well, I guess I wanted to ask like, how do you do that? But like, Annie already had answers to that. So
Did I?
yeah, you have your
Okay.
like 10 interventions that you're gonna run soon.
We're waiting for the answers. We want to know if they work. So
Oh,
Mhm.
I'm
get
going to
on
have
board
to
with
leave.
it. No
Less time
pressure.
to sleep.
So I guess on that note, is there one last thing that you would like to say to the public? What is your final word on all this?
Um, I feel like people are getting less tired of like the COVID has been like going on for so long right now, and it's the vaccines are here, and people are starting to think that there's really no more need, to wear masks and even getting vaccinated, because 50% of the US population is vaccinated already. Some people are like, why should I get vaccinated?
Mhm.
There are so many people who can protect others and themselves. And I want to say that, some of the reasons for this less adherence to like preventive behaviors is perhaps like people have began to think that they're making less impact in terms of like stopping the pandemic and like making the situation better. But there's still much room. That's what I want to say. And even people might feel like their behavior is like a drop in the bucket. Like, a drop in the bucket like 1,000 times, that's going to still make a big impact. So, it's not still too late to go and get vaccinated. So maybe that could be one last comment.
That's such a nice, optimistic last comment. So much better than anything I've ever said.
Or I've said. So see, public health. This is public health in action, people.
Yeah. I don't know how many that will encourage people to go and get vaccinated, but we'll see.
Maybe our entire viewership are unvaccinated people, and we'll have 100% vaccination rate after this.
Give us a shout out too, or give us a comment or something on our page to let us know if you got vaccinated because of this.
Yeah, that would be so rewarding if people were moved by our podcast to get vaccinated.
Annie made me do this. Awesome. No, thank you for all of your insight, Dr. Annie Jung, talking about vaccination stuff super pertinent to our lives right now. I forgot that we had a pre-pandemic life, so that was also a nice reminder. I guess as far as like what's coming up, we will be having Liz. You're going to be talking again here.
Yeah, about donor conception stuff in the next couple of weeks.
Yes.
Yeah.
Very exciting. Yes.
And a nice change of pace as well. We're going to keep switching it up as far as topics go. We have a lot of knowledge to share with people.
Eventually, it won't be just our knowledge. We'll have other people and talk about their knowledge
as well.
Yeah.
Yes. So yeah, tune in for that if you're interested at all in donor conception. And other than that, we have other things on the radar that are coming out. We still post something every weekday, Monday through Friday, on all of our social media. So feel free to check us out on Room for Research on everything: Facebook, Instagram, Twitter, TikTok, Pinterest if you really want to.
All
Tumblr,
the things.
YouTube.
Everything.
Everywhere. Everything everywhere.
And if you haven't subscribed everywhere, we're pitching subscribe to everything. We would appreciate that.
And then there's our website too, roomforresearch.com. Feel free to take a visit there. There is some exclusive content on there already, which, maybe I actually shouldn't make it exclusive and like just put it on social media as well. But right now it is until I actually make an announcement.
And we should note everything's free.
Yes, everything is free. Absolutely.
Yes.
I don't think I've ever said that here.
That's so important that people know.
Yeah. Everything is free. Yes, please. If you're interested, we want to give you free stuff. All right. So with that, thank you all for coming today, and we'll see you next week.
All right. Bye, everyone. See you.
Bye for now.
With the sun will breathe.